Hi everyone, my name is Faisal Uthaybi. According to the Advanced Cardiac Life Support 3rd edition, it's been estimated that 950,000 Americans dies of cardiovascular disease each year, and this is equal 1 death every 33 seconds. 400,000 to 460,000 of cardiac arrest patients dies on the ER or before reaching the hospital. These numbers are huge and terrifying, and in order to reduce these numbers, we need to increase the awareness of basic life support. So, today I will demonstrate on how to perform the basic life support. The first part is the CPR. CPR stands for Cardiopulmonary Resuscitation. The American Heart Association changed the BLS guidelines several times over the past years to make it simpler and more effective, and to increase the chance of survival. So, the first thing we need to do when we see a lying victim is to assure that the scene is safe. And then we need to check the victim's responsiveness by tapping on the shoulder and shouting, "Are you okay? Are you okay?" If the victim doesn't respond, call for help or call 911 and ask them for help. We need to check the pulse by placing the index and middle finger beside the midline of the trachea, and then check the carotid pulse. If there is no pulse, we need immediately to start the chest compression. We will perform the chest compression by placing the heel of the hand under the midline of the breastbone and put the other hand on top of it. We will keep the arm 90 degrees and push 1.5 to 2 inches in depth. Fast and hard, fast and hard. We will perform it 30 times, and then after we do this, we will need to open the victim's airway by placing our hand on the victim's forehead and under the chin and performing head tilt, chin lift, and open the airway. We will use the protective shield to place it on the victim's mouth and blow in. We need to look for chest rise while we are doing it to assure that we are giving a good breath. We will perform 2 rescue breaths. After that, we will go back and do our chest compression. We will perform 30 chest compression and 2 rescue breaths. We need to do it 5 cycles. And then we will need to do these cycles until we will do this cycle. And after 5 cycles, we will reassess the victim's pulse and breathing. If the victims gain consciousness, will stop, or if there is the advanced cardiac life support provider arrives. So this is the first part of the BLS. The second part I will demonstrate is the relief of foreign body obstruction. The universal sign of foreign body obstruction or a choking victims, he will clench on his neck and he won't be able to talk or cough. We'll need to approach the victim and ask him, "Are you okay? Can you talk?" If he will sign, "No, I can't," you need to tell him that I'm gonna help you. And then you need to go behind the victim, make a fist of your hand, support this fist by the other hand, and then push under the umbilicus, push inward and upward. Do it fast until the victim spill out the object, or if he lose consciousness, we need to support the victim and then make him lay down and perform our CPR, and we will do the abdominal thrust after the 5 cycle with reassessment. We will do like this and push inward and upward under the umbilicus. So, Today I demonstrated how to perform CPR and the relief of foreign body obstruction. The first minutes of such an incident have a critical impact on the victim's survival. For this reason, we need to learn how to do these basic skills to save lives. Thank you.